As a typical guy, when I'd be going to bed, I'd put my hand down my pants. You're intimately aware of how your nuts feel. I didn't have a lump or anything, but my right testicle felt harder than my left testicle. At that point, there was no pain. That's all it was.
This is the Man Up Podcast, a doctor's guide to men's health.
If you've been enjoying listening to our podcast, please hit the subscribe button on YouTube, Spotify, and Apple Podcasts.
My name is Dr. Kevin Chu, and I'm joined as always with my co-host, Dr. Justin Dubin. This week's episode is titled, it's part of our Perspectives series, actually, Testicle Cancer, featuring Mike Scherer. This episode, Justin, is to launch and kind of set the tone for Movember, right? A month to, men's health. And one of the things in particular to really take a look at, and we want to highlight, is testicular cancer. Testicular cancer is one of the more common cancers that you can find in men in their late 20s and early 30s. And as urologists, it's something we just keep telling guys, like, keep checking your nuts, keep doing, self-exams. So that's just something we want to highlight, and kind of, this kind of is a great episode talking with someone that is a testicular cancer survivor, right, Justin?
Yeah, and one thing that we always see with testicle cancer, it's almost consistently the situation, is someone feels something on their testicle, they don't do shit about it. And then they wait, and then maybe 6 months, a year, and then you have testicle cancer, or you just didn't do it. So, examinations are key, as we're going to find out. Mike's story is very inspirational. He talks about the struggles of really, even acknowledging that he had testicle cancer, or acknowledging that he had a mass in his testicle. And this is something that commonly guys do. So feel your nuts. If you have something abnormal, go see someone about it. It's literally an ultrasound. It's not invasive. There's nothing bad going on. But a little bit more about Mike. And we were so lucky to have him on because he's the co-founder and chief visionary for Worth the Wait charity. Worth the Wait empowers young adult cancer survivors on their path to parenthood. They provide financial support and educational resources for fertility treatments, adoption, and surrogacy, while advocating for oncofertility within the healthcare system and beyond. And, they were founded in 2021 by Mike and his wife, Megan Scherer. Just 3 years into their marriage, Mike was diagnosed with testicle cancer. And after surgery in 2011 and chemo in 2012, he was declared cancer-free. And, now he has really two incredible stories. We're going to focus on today his testicle cancer journey. We're going to have him back for his fertility journey as well. And the other thing that we do want to highlight, if you have cancer of any kind as a man, especially testicle cancer, the first thing you should do is consider banking sperm. Sperm banking is so important. People are thinking about life and death, but most cancer survivors, specifically testicle cancer people survive. It's a highly curable disease. There's life after cancer. We need to make sure that you're living your best life. And if family planning is in the cards, you need to be giving yourself that opportunity.
I think that's well said. So we should jump into the episode. And Mike, if you're running this back and listening, go Steelers. We beat Justin's Giants. I know we talked about that offhand. So,
all right, guys, as always, check out the pod, check out our YouTube. We are now on LinkedIn as well. So follow us on LinkedIn. We're trying to push that as well, at the Man Up Pod, on Twitter, Instagram, and TikTok. Follow us all over the place, and, enjoy Movember, guys. Take care of yourselves.
Oh, also, just one thing I want to add.
Yeah.
Now you can comment on Spotify now. So guys, go for it. It's so easy. If you're listening to the podcast, if you got something that comes to your mind, just kind of type it. We'll see if we can kind of get back to you.
Yeah, that's a great point. We're happy to respond on comments on Spotify. Let's do it, baby. All right, we're joined by Mike Scherer here, who has a remarkable story, and him and his wife are doing remarkable work at the Worth the Wait Foundation, which was really inspired by this story. And, just to highlight Worth the Wait quickly, they empower young adult cancer survivors on their path to parenthood. They provide financial support and educational resources for fertility treatments, adoption, and surrogacy, while advocating for oncofertility within the healthcare system and beyond. So what they're doing is really, really important work, because as we're going to learn in this conversation a little bit, and in the second part where we're discussing more fertility, A lot of places and a lot of insurances really don't cover fertility, even in the setting of cancer. So today we're going to really just start with his journey with testicle cancer, and then there'll be a second part of this where we're going to talk about him and his wife's fertility journey. So, Mike, can you just tell us a bit about yourself and your life in general before you were diagnosed with testicular cancer?
Yeah. I was diagnosed at 26. So I like to think the stereotypical like 26-year-old young professional. I was a little unique because I had gotten married at 23. So my wife and I are high school sweethearts. We've been dating forever. We were like 15. But so we got married at 23. We both had really good careers and were doing really well in them. And otherwise, we had no responsibilities. We lived in a condo, so we didn't have to do any yard work or anything like that. So we were working, and then we were having a lot of fun, just hanging out with friends. I was very active. I played, sports, rec hockey, and hung out with my buddies and did a lot of working out and that kind of thing. So yeah, just kind of, enjoying the young professional life and really looking forward to the future and what that would hold until we got the news that I had cancer.
So this news can't. So wait, first, tell our listeners, how did you first discover that something may be wrong?
Yeah. So I tell the story a lot. As a typical guy, when I'd be going to bed, I'd put my hand down my pants.
Yeah,
And
hell yeah.
right. And so, you're intimately aware of how your nuts feel. And I mean, frankly, it's a good thing. But, I was trained like any other, teenage kid. Hey, you got to do self-exams in the shower and that kind of thing. I didn't find it through self-exam in the shower. I found that something was wrong when I was going to bed one night, put my hand down my pants, and I didn't have a lump or anything, but my right testicle felt harder than my left testicle. At that point, there was no pain. That's all it was. And so this was January of 2011. And, I didn't really think much of it at that point. I just kind of was like, that's a little weird. I'm sure I'm going to touch my nuts again the next time I go to bed. So we'll just see what happens. So, I didn't actually do anything about it until May of 2011, and other symptoms started popping up.
Well, that's exactly where I was going to go next, because I think the standard patient that we always see, it's, I've had this for about 6 months. It's starting to get bigger. I don't really know what's going on. Now, what was the turning point? So you literally waited 4 months, and this is just the reality of what people have this situation. And that's why we're talking about it now, because if you feel something, if something's off, you should go see a doctor as soon as possible. But, what was that triggering point that you were like, okay, it's been 4 months. Like, I need to actually go see a doctor about this.
Yeah. So, I had gotten a promotion at work and I moved into an office, and I was setting up a computer and all these cables underneath my office. And as I was getting under my office, I adjusted my legs and it felt like I got kicked in the nuts. And I kind of started thinking back and I realized, like, man, it's kind of felt like I've been getting kicked in the nuts a lot recently when I haven't been really doing anything. And that's not normal. I hadn't noticed a change in the size or shape or anything like that of my right testicle. It was still firmer than my left. But the kicker was I had tenderness in my chest, in my nipple region.
Interesting.
And so it got to the point where I Googled it. I Googled tenderness in my chest, and I Googled a hard testicle, and literally the first thing that popped up was testicular cancer. And I think it's funny to talk about how guys just let stuff go because I have a crazy family history of cancer, not testicular cancer, but cancer in general. And my parents are both in nursing. So medical care was always easy for me as a kid. If something was wrong, my mom would get it taken care of real fast because she'd just talk to the doctor at work, who was my doctor, and everything was good to go. But when I was on my own, I just, I was complacent about it. But the side effects got so bothersome, and kind of the mental stress of this is going on got so bothersome that I sat down and I said to my wife, like, hey, I'm having these symptoms. I Googled it and testicular cancer came up. And immediately she's like, go call your primary care physician and get in tomorrow. And so I did. And, the tenderness in my chest was HCG. So the germ cell tumor was giving off HCG.
Wow.
So, right.
Very
so I'm getting ready.
I say that. Like,
I
I've very
haven't seen
rarely
that.
seen that.
Well, and so that's true. You typically don't see that. I had choriocarcinoma and embryonal carcinoma in my tumor. And so choriocarcinoma gives off HCG.
Yeah, it does. It does. And,
Yep.
I had Kevin, I think he highlights a lot of important points. When it comes to testicle cancer, it's in a younger population, right? This is the most common cancer for younger men. The age we see guys getting cancer is in their 20s and 30s. And at that age, you still feel pretty invincible, and you don't think that this is cancer. It could be anything else, but in your mind, you're a young guy. Well, this couldn't be cancer. So you delay and you delay. But, this is a young man's disease, unlike many other things that we talk about, especially cancer.
Well, so the other thing that I tell a lot of people about now, because I think it kind of gets people to the realization as to how serious testicular cancer is, and it strikes a young population, which no one thinks about. If you remember the movie Brian Song, which it's an old movie, well, Brian Piccolo, most people think he died of lung cancer. He died of testicular cancer.
Metastatic testicular cancer.
Right. And, so then you're like, okay, this was a guy who was a college, or, not a college football player. He was playing for the Chicago Bears. Prime of his life, in great shape. And he died of testicular cancer. And, I was in great shape. I worked out all the time. I drank too much beer, but otherwise I took care of myself. And yeah, I had cancer.
That's such an important point, that just kind of what you said there. And because I've known people, aside from my own patients, I've known people who've passed from metastatic testicular cancer.
Yep.
And most of these guys, healthy, worked out all the time. And you just were like, I just didn't think that something was actually happening. Look, talk to me. It's hard to get me to go see the doctors, and I'm a doctor. It's just a guy thing where we're just like, it's going to get better by tomorrow. I know it's going to be. It's going to go away. But it's so important with this in particular that to quit, like Justin, as you like, minute I get one of these diagnoses, I'm trying to get the patient into the OR, like adjusting my schedule to get it in as soon as possible, because time is really money in these cases.
Yeah.
So Mike, just for our listeners' education, what do they do to assess you for your, to assess if you had testicular cancer?
Yeah. So my primary care physician was awesome. And the crazy thing too is I was a brand new patient with this primary care physician. I had seen him one other visit for a regular physical. I think it was about 3 to 4 months before I called him and said, hey, I think I have cancer. So I'm sure he was thrilled to take me on. But he was fantastic. I went in and he said, okay, what are your symptoms? I told him my symptoms. And he said, Mike, I'm not the expert in this. I'm not even going to do an exam. I'm going to order you an ultrasound. So we're going to get this ultrasound and we'll go from there. The tough thing is, in ultrasound, it was scheduled like 2 weeks out. I had Memorial Day coming up, so I get it. Like, places are busy. That is where, I benefited from the connections with my family. My mom and dad knew what was going on. I talked to my mom and my mom said, no, give me a second. And she called a friend who is, an x-ray tech, who got me in a day for an ultrasound.
Amazing.
Yeah, so, I got the ultrasound, most awkward ultrasound of my life. I'm trying to make conversation with the guy, and, he gets like, "Hey, how's your Memorial Day going?" As he's just like lathering up my nuts. Which for any guys, if you're dealing with this, like they warm the gel and it's awesome. So make sure, so make sure they do that for you, because I was kind of like, can I take some of that home? Because this is, but the ultrasound, like he got super quiet, and I said to him, "Hey, this, like the tone in this room changed, so I'm gonna assume this is bad." And he said the right thing. He said, nope, just relax. Like, I can't diagnose anything. You'll find out the results soon." I got out to my car and I got a call from my doctor literally like when I started my car, and the doctor who gets everything electronically said, "Hey, I need you to come in right now." And I went into his office. He said, "Yeah, you have a mass in your testicle. I'm going to draw blood and check your tumor markers." So he drew HCG, AFP, and I think it's LDH was the other
LDH,
one. And HCG was elevated, AFP was elevated, LDH was not. And so he right then and there was like, there's no other explanations for this. Like, you have testicular cancer. So he referred me then to the James Cancer Center at Ohio State, and I met my urologic oncologist. I want to say it was like a week later. Went in and he basically said, "Yeah, you've got testicular cancer. Next steps, we're going to schedule surgery." His OR was booked about 2 weeks out, and he said, "So that's, your surgery is going to be in about 2 weeks, but because we want to treat this as soon as possible, the minute I have a cancellation, which I will have, we're going to open that up and you're going to get surgery. So just be ready anytime in the next 2 weeks." So I got a call on a like Wednesday, and my surgery was on a Friday.
It's amazing.
So yeah, and I'm pretty sure they also did a CT scan with contrast in the meantime too, and a chest X-ray. So my CT scan was negative and my chest X-ray was negative. So the tumor markers and the ultrasound are how they diagnosed me.
So there's a lot to kind of break down at this point in it. And I think one of the things to highlight for guys who are scared to go to the doctor and talk about these things is you mentioned what the workup for testicular, nothing was invasive, right?
No.
You had some blood work. No one's stabbing your testicle. No one's, doing anything weird to you. You had an ultrasound with warm lube, which was the most
felt amazing.
Part,
Sounds awesome. Sounds awesome.
Yeah.
You have a CAT scan, you have some blood work, you have an ultrasound. Literally nothing embarrassing about it, nothing, painful about it. So, that's one thing that I think we really need to highlight is the painlessness of getting worked up for something as serious as testicle cancer. So the workup should not scare you, because it is, obviously something that is needed and really, minimal effort, minimal risk, minimal harm to you. I think my question really for you now is, having, gotten the ultrasound, you talk with your urologist, you talk with your primary care, you see the blood work results, the ultrasound results. They say, you probably have cancer, you need surgery. What's going through your mind at this point? Like, what are you thinking about this diagnosis, and taking that next step about preparing yourself mentally for surgery? Because, you're a young guy. Like we said, most guys are not thinking that they have cancer.
Yep. Yeah. So again, because they basically, they can't diagnose me until they get the tumor out and see pathology and stuff like that. But they're like, "Listen, you have cancer."
Yeah. The numbers are saying that.
Yeah. So I'm going off of that. And, unfortunately in my family, cancer wasn't new. At that point, at me being age 26, my dad had already had 2 different types of cancer. And so I watched him go through that. So he had a type of salivary gland cancer, and he had a very rare blood cancer as well. So we knew doctors at the James. I mean, as strange as it is to say, I was comfortable there. Um, so what's going through my mind is basically, okay, let's get this done. Let's go through surgery. Just tell me what I need to do. I'm ready to show up. I'm ready to do it. My doctor said, you should bank sperm. And, you know, again, I had the benefit of I was married. And if it had just been up to me, I said no. And I said no because I'm thinking I know the survival rates of testicular cancer are extremely high, and I'm not even thinking about having a family yet. So that seems like another awkward interaction. I don't even want to deal with that right now. Let's just go through surgery and see what happens. That's when my wife said, hey, you freaking moron, let's sit down here and talk
Voice of
about
reason.
this. Yeah, I mean, and she's like, you do this all the time at home anyhow, so just go do it here and bank it. So it like, again, I think this isn't, you know, too unique though. When you look at the statistics, especially with the work we're doing, guys don't do it. And, you know, whether it's just because they don't, like, I didn't have a desire to be a dad. But at the same time, I don't think you really can have a strong desire to be a dad until you're a dad. Like, you don't know until you know. So thank God my wife stepped in. I went and banked. It's the easiest thing ever. It doesn't take long. You know, yeah, it's a little awkward, but get in, get out, get it done. I think the important thing is I didn't really have a semen analysis explained to me when I banked. And even if it had been explained to me, I didn't understand it. So if they said like, hey, you have 4 million, you know, sperm, I'm thinking like, holy crap, I'm in
Right,
investment.
right.
So I'm like, you got $4 million invested, you're doing pretty good. But when I hear that for sperm and I'm thinking that's fantastic, and then the doctor says, no, that's actually pretty low, I would have banked multiple times before my surgery and I didn't. So that's something, advocate for yourself, get the analysis, understand the analysis, and then understand, you know, especially if you're going further and doing IVF or IUI or something like that, like you need a decent amount of sperm. So you might have to bank several times. But yeah, so banking became a big thing. Once all that was done, I got ready for surgery. I wanted to understand the implications on, you know, my work life, what that was going to look like. The surgery is not all that difficult. It was done outpatient. I went in the morning. It's a radical orchiectomy. They actually remove your testicle through your groin. I was I was at home that night with frozen peas on my incision. And you know, I was a little sore. The next day wasn't too bad, but 2 days after that, I was taking a walk and I could barely stand up straight. And after that, I was totally fine. Totally
A
fine.
lot,
So
a lot there that I just want
yeah,
to kind of recap and highlight. But that was great. Thank you so much for that. So first off, you know, sperm banking, very, very important. And just like you pointed out, a lot of guys do kind of gloss over that, and they just end up getting the orchiectomy without banking sperm. And it's so important. It's a quick thing. Justin always likes to talk about like, hey, look, guys, you just got to jerk off into a cup. How hard is it for us to do that? It's
right.
not hard. We could do it, you know. And so it's really important. I know Justin and I definitely spend a little bit more time just because we're fertility specialists with our guys that are going. We're like, this is important. Get it done.
Hmm.
And another thing I wanted to point out was just, you know, the surgery. A lot of guys come to me and say, like, so you're going to cut into my scrotum. You're going to, like, open up my scrotum from below and get that testis out. No, actually, in this case, we actually take the testicle out from a groin incision. So your incision is actually, you know, depending on the size of the tumor, it's up in the groin area, not on the scrotal area. So that's a common misconception. Justin, do you have anything to add?
Yeah, I mean, I want to highlight the fertility banking, the sperm banking, and I think that one of the reasons why younger guys don't do this is because, and honestly, all cancer, it's not just, it's any young person with cancer, they're kind of shook with the idea of actually having cancer. That I think that they're not even focused on life after cancer. But as you alluded to, testicle cancer has thankfully a very, very, very high survival rate. And one of the things that Kevin and I are passionate about, and one of the things why we do men's health is because, we're able to provide men with an opportunity to show like there is life after cancer, right? We live in 2024. A lot of people are living after cancer. And, if you are someone who is going through it now, your future self, because there most likely will be a future self, will definitely appreciate you banking, right? And it's so easy. And you mentioned the uncomfortableness about doing it in the hospital or doing it either in an IVF clinic or in some random room. We now even have the technology to do that at home, right? Kevin and I, we've worked with Fellow, shout out to them. You can do a sample at home for these things. I've had multiple patients do that. And I think the other thing you have to understand, like you highlighted, is the amount of sperm, right? I often, the one problem, especially if you're going to get chemo or you're going to get radiation or you're going to get surgery, is you are time constrained, right? So, if you can, I would say ejaculate every day into a cup and just provide whatever you can. But often patients with cancer, data shows their sperm quality is not as good, and it makes sense, right? You have an inflammatory process going on. So your body is not really working the way that it should be. It's kind of trying to fight cancer. It's not trying to have a kid. So, the sperm quality is often less good when you have cancer than before you had cancer. So often you don't get as much sperm to bank in these situations. So the more is better. Each vial you bank really represents about one cycle of IVF. And how long does that last? It really depends on a lot of things. But, if you can get 6 to 8, man, you're in a much better situation. Now, I'll take one, and I have said one's great, and it depends on the situation, but, the more, the better. So, don't be satisfied, like you were saying, with like just banking one thing, because, not everything's guaranteed in this world. So, I mean, just following up on the testicle surgery, the recovery seemed pretty easy. One thing that we always ask, Kevin and I always ask our patients is about a testicular prosthesis. I would say about 50% of my patients get them. Kevin, what percentage of your patients get it?
I would say a little less than 50% would say my patients. A lot of them kind of have that same kind of hone in, like, hey, doc, like, thanks for telling me about it, but I just want you to get it out. Like that's all I care about. I don't want to deal with anything right now. Just get it out. So.
Yeah, and I just wanted to, so it sounds like you did not get the prosthesis. Just tell me your sentiment with your decision there, because I'm sure people listening will be like, yeah, I'm offered it. I'm trying to figure out whether I should do it or not.
Well, and again, I hate to bring everything back to the point where I was married, but I was married. Like, I still am married. Like, it's my wife didn't care. It's not like I was on the dating scene and I didn't want someone to say like, "What the heck's going on? Why do you only have one testicle?" But I can totally understand. Like, the doctor talked about a prosthesis. They explained it, and I knew the pros and cons. It was a very easy decision, very quick for me. I just said, no, I'm not worried about it. Let's just get it out. And I'm fine living life with one ball. But again, I didn't have to deal with some of the awkward things about, being in the dating scene and wanting to not feel even more unique since, hey, I already had cancer. Now I have to actually like show people that I have a scrotum that's half empty, right? Yeah. But yeah, so it was never much of a consideration for me. But I can totally understand why it can be.
I mean, they feel just like a testicle. We size them. So Justin and I, we take that into consideration. So you're not going to have some lopsided looking like, oh, that's clear, that's not a real testis. No, we make it. It's a little bit of art, but we make sure that it's
Like a Super Bowl in there.
Listen, we'll charge you if you want 4 of them. We can do it. But we'll make it look like a big bushel of grapes or something in there.
Oh man. So look. All right. So Mike, after surgery, you get your path back, and you typically get imaging, but you had imaging already before, and then they assess you for possible further interventions like chemotherapy. So why don't you tell our listeners what was your pathology results and what happened next?
Yeah, so I can't remember the exact percentages as far as my pathology goes, but I can remember I had all 4. I had embryonal carcinoma, which made up 60% of the tumor. I had teratoma. I had choriocarcinoma, and I had yolk sac. So I had all 4. So it was non-seminoma. Imaging became very important at that point. So I actually got another CT scan after surgery too. My CT scan still presented negative. No lymph nodes were enlarged. My chest X-ray was still negative. But we were still testing tumor markers.
Right.
And so they were watching to see if my tumor markers were going down to normal levels based on the half-lives of these chemicals in your body. That was the interesting thing. My tumor markers went down. I can't remember, it was either the second or the third HCG test I had. My HCG popped up again. And so the doctor said, okay, we're going to draw blood again, and we're going to see if this was a false positive, because if it's not a false positive, you're probably going to get like 1 or 2 rounds of chemo. They drew blood again, and it was down to normal levels. So all my tumor markers had returned to normal. At that point, my options were RPL&D surgery, lymph node dissection surgery, or surveillance. And I don't like surgery, especially.
I think that's
fair. And especially, the RPL&D surgery. I know people that have had it, and they're rock stars going through that surgery. I wanted to avoid that at all costs, so I chose the surveillance route.
So, just to highlight some of the things you were talking about there, monitoring usually after surgery. Once again, nothing crazy, right? There was nothing, no real poking or prodding. You get the tumor markers, the LDH, the AFP, and the HCG levels. Frequently, you get additional imaging, usually a CT chest, probably in your situation, and a CT abdomen pelvis to see if there's any spread. Now, when we look for spread for testicle cancer, it's usually in your lymph nodes, the retroperitoneal lymph nodes, which are in the back, like not really the back, I guess the back by your spine is how I would put that. Kevin, how do you describe? Like they're by your kidneys, they're by your aorta, they're on the the posterior part of
the back
of
50% of your body.
Yeah,
there you go.
Yeah. And that's where they drain, and so that's the typical spot that we're looking for spread of your testicle cancer. And RPL&D is retroperitoneal lymph node dissection. If you do see it or you have suspicions, and to be honest, testicle cancer staging, planning, the algorithms are incredibly complicated after you take out the testicle. The testicle part is the straightforward part, but there's a lot of different things because there's, as you were alluding to, there's germ cell, there's non-seminomatous, there's seminomatous. Sometimes it's a pure, sometimes it's a mix. There's different versions of each kind. Then you have staging. Is it just in the testicle? Is it going outside of the testicle a little bit? Is it in the cord? Is it, right. So there's so many different levels to it for staging that you really are going to see someone who's a true oncologist at that point to make the next decision. But the good news is there's so much data, there's so much, this has been so heavily studied that these algorithms, one way or another, should get you to your final destination, which is cancer-free. Now, you were on surveillance, but I think you ended up getting chemotherapy at some point. So what happened? You were on surveillance, and then what progressed that something was concerning there?
Yeah, so I went on surveillance, so I was just getting, again, my tumor markers, CT scan, chest X-ray, and it was every 8 weeks at that point. And the progression changes. So if your CT scans, if all of those tests come back negative, it spaces out. Um, but I was every 8 weeks, so I'd go and get those tests done. I'd visit with my oncologist for 30 minutes after the test would be done, and he'd tell me to come back in 8 weeks and do the same thing. It sounds like a lot, but within a year, so it was almost a year to the day, I had had a CT scan in, I don't know what it was, like April or something, and everything was clear. And then I had a CT scan in early June, and I had swollen lymph nodes. And there were about 3 or 4 swollen lymph nodes. It's that quick that all of a sudden, hey, you have it's spread. So you're having a recurrence. I was upped to stage 2 at that point, and I again was kind of told the same thing, like, hey, we need to be aggressive with this, we need to be quick, you're going to get chemo's going to start on Monday. I was talking to the doctor on a Tuesday, and that's when you're seeing a medical oncologist now. So I sat with my medical oncologist, awesome doctor, sat me down. They have to tell you all the risks and side effects and things you need to be aware of, which is a pretty daunting conversation because chemo's no joke. But at the same time, he also said, hey, listen, we're going to take care of you. You show up for the appointments. Let us do everything else. Go bank sperm.
Boom. That's what I was going to ask. Yeah.
Right. So I banked sperm again. And I got pulmonary function testing because I was receiving bleomycin. So, they want to monitor your lungs through that. And then, I had a few days to basically tell everyone at work, like, hey, I'm going to go through this pretty intense chemo regimen. If you know chemos from other cancers, you get chemo maybe once a month, once every 3 weeks, something like that. I was getting chemo 5 times a week, so Monday through Friday for the whole thing takes about 6 hours. And then the next Monday, a bleomycin push for, that's not a long push. I would be in the office for maybe an hour to 2 hours. Another bleomycin push the next Monday, and then start the whole cycle over.
I mean, that's some, Mike, first I'll commend you. That's real stuff that you're
Yeah.
going through, right? I mean, talk to our listeners about the chemo. Like, was it
Yeah.
making you tired, like causing you to be like, the energy just really takes a hit, right?
Yeah, I had an awesome support system. So there were a lot of people that were around to help lift my spirits, and I think that's one of the important things when you're going through a chemo that's this intense, because I will tell you, like, you're drowning in chemo for testicular cancer. Um, all the side effects that they tell you you're going to have, I had. I had, very little energy, was very tired. I wasn't terribly nauseous. When I was nauseous, I didn't try to be a hero. I took my pills. And, they give you Ativan. Like, I didn't want to take it, but if I was super nauseous, I'd take an Ativan. And Ativan's pretty awesome.
It's great medication.
So, it's, and that's the thing. Like, everyone's different. I never actually threw up all through chemo. I lost my hair, and we're talking like my eyebrows were coming out. My
Right.
eyebrows got really thin. But let's be honest here. I didn't have to shave, and that was pretty awesome. But
There's a silver
so
lining, man.
yeah. So I think that's the thing. Like, it's a marathon. My job as the patient was to show up and to do what the doctors tell me. Um, And so the only other thing, I was receiving bleo, and I had a reaction to bleomycin after the second bleomycin push. Spiked a fever of like 103. horrible chills, all that. I knew what was going on because I had been in testicular cancer forums and that sort of thing. So I I'm dumb and I treated myself with Tylenol and my fever came straight back down. So I didn't go to the ER. That was stupid. And, the doctor says, hey, if you spike a fever over, I can't remember exactly what it was, but I want to say it's like 99.5, you go
It's
to
like
the ER.
100.3 usually, but yeah.
Yeah, I mean, I can't remember the exact
Yeah.
thing, but because they're worried that, I'm immunocompromised and I
Right.
have an infection. Um, I had only had 5, days of etoposide cisplatin at
Mhm.
that point. So I realized, okay, I'm having this reaction. The Tylenol took the fever right down. I told the doctor the next visit, and they just started putting me on Decadron before I'd get my Bleo pushes. So I felt like Mark McGuire. I mean, I was like all swollen. And that was the other thing with me because they were pumping me full of Decadron. Like I was hungry. So I had, kind of the opposite reaction. A lot of people don't want to eat anything. I wanted to eat everything because I was being pumped full of
Interesting.
these steroids. Yeah.
That's fascinating. So there's one thing I do want to highlight just again, because I mean, we're going to talk about fertility a lot in the next time we have you on, but it was so important once again that they highlighted you and you really encouraged you to get, you know, uh, bank before chemotherapy, because one of the big things chemotherapy that's different than just surgery, right? Surgery, we remove the testicle. But once you do chemotherapy, that's impacting your whole body, and your testicles, and especially, have germ cells where your sperm is created. And truthfully, when you have chemotherapy and things like radiation to an area like that, it can potentially permanently damage your ability to create sperm. Fortunately, the majority of men do recover, but that's not everyone. And even if you do recover, and you're feeling okay, you cannot. Our guidelines say you should not be trying to have a child for at least 1 year after completing chemotherapy. Why is that? Because I mean, to make it be blunt about it, we really fucked up your genetics, right? That's the whole point of chemo, is to kill all the fast dividing cells, which the ones that reproduce your sperm are some of the fastest ones. So those are the things that are damaged the most, and you need to give it time to kind of recuperate. So there's a couple of things going on there when you're taking chemo for your fertility. One is that you may not have any fertility after, and if you do, it could be declined, and it also may be an issue where you're going to be delayed in family planning unless you have some bank sperm. So I just really wanted to highlight that part, because it was really great that your team was thoughtful and forward thinking enough to do that. Now, my next question for you is, you complete chemo. BEP is what I'm guessing times 4 or times 3 did you do?
So it was not in my lungs, so I only had to do 3.
Okay, so and that's the standard chemotherapy. That's 3 cycles of bleomycin, etoposide, and cisplatin. So you complete that, and what's next for you? Like, so you're cancer free, or how did they tell you this? Like, what's going on?
Yeah, so you actually go back on the surveillance routine.
Right.
So, my doctor did tell me a couple things. They were happy I only had to do 3 rounds because there was, you could see on pulmonary function testing, because you continue to get pulmonary function testing, that I was having issues with my lungs due to the bleo.
Hmm.
They didn't stop the bleo or anything, but they wanted to be aware of it. And so my doctor did mention to me, like, hey, yeah, it's a good thing we're only doing 3. But, I just went back on the same surveillance routine. And because I had had chemo, my visits with surveillance spaced out quicker because, again, that chemo is no joke. It does its job.
Hmm.
Um, and so if I was presenting, cancer free after that chemo and I stayed that way, it moved out to, after a couple 8-week visits, then it was all of a sudden I don't need to go for 6 months. And then after a couple years of 6 months, it was once a year. Um, after 5 years, my oncologist basically said like, hey, listen, I'm comfortable releasing you from my care. If you're comfortable with it, if you want to see me, no problem. Which is actually kind of funny because my medical oncologist, and we found out this later, he's my neighbor down the
Oh,
street.
that's
So I'm like,
wonderful. I
I'll
love
just
it.
walk down the street. But he was like, listen, if you're comfortable having your primary care physician do this, I would ask them every year to still do tumor markers. So I do a tumor marker draw once a year. And but otherwise, after 5 years, he said, "Hey, congratulations, you're cancer free, and the odds that you get this again are pretty much like any other guy that is, walking around if they get testicular cancer." I think things that I think about now, like again, I didn't have testicular cancer in my family, but that's a risk now, right? I had testicular cancer, and I have a son. And so that's something that my wife and I are very cognizant of. Like, okay, he's going to have to be aware of it because that is one of the, indications that you have a higher chance of getting testicular cancer. I didn't have an undescended testicle, which strangely enough, that's another one.
Mm-hmm.
But yeah, I mean, who knows why I got it. But after going through surveillance and presenting, cancer free, that that was it. And I should mention actually, so after I was all finished with chemo and my CT scans and chest x-rays and all that stuff came back clear, my medical oncologist said, "Hey, your surgical oncologist might want to do an RPLND. So I'm going to refer you back to him, go meet with him, and we'll see what they say." I met with my surgical oncologist. It was a very quick visit. He looked at all my test results, that kind of thing. I was somewhat surprised because I was thinking, hey, I'm meeting with a surgeon. He's probably going to want to do surgery just to make sure my lymph nodes look good. He said, get out of here.
Awesome.
I don't want to do this. And so I didn't have to do the RPLND. And, knock on wood, that was 2012 when I finished chemo. It's 2024 and I've been all good.
Well, Mike, on behalf of Justin and I, fuck yeah, man, that's awesome.
Yeah,
that's
fuck yeah,
thanks.
that's
Yeah.
such great, such a great, play out of everything. As you look back on all this, you've been through so much. Overall, what would you say is the biggest lesson you learned during your whole experience dealing with testicular cancer?
Yeah. So, I mean, I learned a lot of lessons, and I think the big thing that I've really learned now, I was selfish. And the reason I say that is I was scared to go to the doctor when I felt like something was wrong. And I was scared to even tell my oncologist things while I was going through chemo because of the effect it would have on me. And what I've realized now that I'm finished is cancer was so much harder on the people that I love that were watching me go through it. And by not going to the doctor, I wasn't thinking about them. And, hey, I didn't go to the doctor. It turned out to be cancer, and it turned out to be cancer that spread into my lymph nodes. And we're lucky the chemo worked because I could have made a decision that took me away from, at that time, my wife. Now that I have a son, I'm all over it, right? So
Right.
I proactively see a physician to get blood work done all the time. We're talking every 6 months at least, just to make sure I'm taking care of myself and I exercise, I eat right because I want to be here for the people that I love. And so by not taking care of myself, by not going to the doctor, by being afraid of those things, I was actually being selfish. And, chemo was brutal, but it was worse for my wife, who was my caregiver. It was worse for her because I knew there's nothing that's going to make me feel better right now other than an Ativan and laying on the couch and watching, Pawn Stars or whatever I was watching at the
Great
time.
show.
Right? Yeah. So, like, I knew that's what I'm going to do. I'm not going to feel better, but whatever. Like, but I'm watching my wife desperately want to do something to make me feel better, and she's powerless and she can't, and she struggled with that mightily. It's it's harder on the people that are around you. And I mentor a lot of young cancer patients now, and I call it the burden of the cancer patient. But my perspective is the cancer patient has to be the strongest person for everyone else while they're going through this. People are not going to say the right things because they just don't know and they want to relate to you. So they're going to say something and you're going to be like, why did you tell me that? Or whatever, like, you're a moron, right? But the burden of the cancer patient is you need to be the strongest person. You need to let those things roll off your back, and you need to give other people grace and give other people a break because they just are trying to connect to you and they truly don't understand. So it sucks, but you can do it.
I think it's a great message. It's a very good perspective in thinking about these things, right? You're doing these things not only for yourself, for your loved ones as well. And that kind of was a natural segue to the next question I had. Like, how important was your support system in this process? Your friends and family, because as you already said, you're not alone in this process.
Right. It was really important. My wife, again, she's awesome. And she had actually organized like a chemo buddy for me every day. So when I was getting my chemo 5 days a week, I would wake up and some new friend would show up and they were driving me to chemo and hanging out with me that day. And they knew, like, some days I'd look at them and I'm like, guys, I'm just going to chill and, don't worry about talking to me. There's nothing you need to say or anything like that. Like, we're just going to be awkward together. Now, later on in the cycles, when I'm in the third round, I'm so beat that they're putting me in a hospital bed and I'm basically just sleeping the entire time I'm getting my chemo. So my chemo buddies were pretty boring or bored at that time. But yeah, people would come into our house and they'd get in like biohazard suits and clean our bathrooms for us, so we didn't have to do it. People would bring food, and it's kind of funny because you're like, well, I'm on chemo, so I wanted to eat everything, but a lot of times with cisplatin, you have a metallic taste in your mouth, and you don't want to eat stuff that you love because it tastes like shit. But again, people are just showing love when they do that. But it's the other thing that I'll say is it's so important to reach out and talk to people about how you're feeling.
Yeah.
And I didn't do that. And I broke probably 2 to 3 years after treatment. I was having major panic attacks. I mean, it was great, and I didn't know what was going on. And so I finally saw a therapist, and the therapist's like, you got PTSD, dude. Like, you have all the signs and symptoms, and you've got to deal with this, or it's going to consume you. And, I just had to unpack that and move on from it. But had I not talked to someone, I wouldn't have known what was going on.
Family and friends, very, very important, So,
Yep.
All right, Mike. So we see a lot of guys delay seeing a doctor because they're embarrassed to talk about something on their nuts. Get it. And there's a huge stigma around men's health, why Justin and I do this podcast. So what advice do you have to men who are concerned about their health and are not seeking help?
Again, I think if you have people in your life, think about them. And think about, okay, if something really is wrong and I'm delaying this, how are they going to feel if, unfortunately, I'm not here because of this decision? I think also, again, it wasn't that hard. My job was to show up, and I had only had blood drawn one time before I got tumor markers drawn. I'm a blood draw pro at this point. And, all the IVs, because I didn't get a Porter or PICC line, I did IV chemo because I was 26. I worked out. I had great veins, which I don't anymore. They're shot.
Yeah, that's
Um,
chemo will do that.
yeah, but so getting stuck with needles sucks, but it's not that bad. And it sucks a lot more to have a cancer spread because you didn't do the right thing. So,
100%.
like the name of your podcast, and I know it's people can say it's cliche, man up and just go do it because there is life after cancer, especially testicular cancer. My life now is amazing. And not only that, like, yeah, I went through a real shitty situation, but I gained so much wisdom and life experience through the situation. It took me a long time to realize it and to turn it into a positive, but you can do it.
I think
So, yeah, man up
good.
and go get it done.
We're gonna clip that for sure. Fuck yeah, we'll clip that. uh, but I think just that's a great message. And I think the one final thing, I mean, that was a general, get better, get the help you need. But I think some of the listeners maybe are newly diagnosed men with cancer, right? They newly diagnosed men with testicle cancer, listening to this, listening to your perspective. So, I think the final message here, like, is what advice do you have for men who were recently diagnosed with testicle cancer from someone who's gone through it?
Yeah, so again, I mean, depending on what your diagnosis is and what your treatment plan is, it can be a marathon. Take your pills if you're getting chemo. Show up, do what the doctors tell you. Tell your doctors what your symptoms are because they've experienced this. They know what to do. They're here to help you. And realize again, there is life after cancer. I have a son. My son, we conceived in 2017. Yeah, we went through a lot of fertility treatments. It still happened. So we'll talk about that story later
Yeah.
because that is a pretty wild, chain of events, and he truly is our miracle son. But there is life after cancer. I still have side effects because, my body's way older than the 39-year-old I am because of all that chemo that was pumped through me. But man, I'll take those side effects compared to not being here.
Dude, you look like you're 32, man. I
Yeah,
have no
no.
one can say it. Dude, you look good, man. You got a
Yeah.
full head of
Well, it's
hair. You got your jacked. Like, you're good, dude.
yeah, it's the hair is thinning, and I must have flattering light. But thank you.
All right, man. Now, Mike, just highlight your work that you're doing for our listeners. Again, I know I mentioned in the beginning. Tell our listeners about Worth the Wait and where they can find the information on Worth the Wait, and
Sure.
also tell us where they can find more about you.
Yeah, so Worth the Wait is a charity my wife and I set up. We set it up in 2021. We struggled with cancer-related infertility, and we struggled with it for years. And there's not a lot of insurance help. In our case, there was no insurance help for any of our infertility stuff, and it's expensive. So once we, finished all of our treatments and had our son, we realized we want to help other cancer survivors with the path to parenthood if that's something they want to pursue. And we do it through financial assistance grants. So we will give grants for emergency preservation. We can fund grants, sometimes within 24 hours and pay for someone to go get sperm banking, semen analysis, that sort of thing, egg storage, egg freezing, embryo creation. We can be very quick on, approving a grant after an application is filled out. And then we go a step further and we do family building grants too. So someone comes to us and says, hey, I was diagnosed with cancer. I had a bone marrow transplant. I need a surrogate at this point. We will provide financial assistance to help them be able to do that as well. You can find more information in our application at worththewaitcharity.com. You can find out more about Megan and I at that website as well. We do a lot of advocacy and education events at this point because, that's the other big thing is the certain doctors, you two, get it, right? You're reproductive experts for males. You understand that sperm banking is important. Not every oncologist is like that, and they want to treat the cancer. So the statistics are pretty dismal as far as, people being counseled to bank sperm, and we're working our butts off to try and make sure people understand how important it is because we have more young adult survivors than we've ever had before, and these young adult survivors have a future, and that future could include parenthood, so you have to do the right things.
Awesome, man. All right. So, Mike, this is part one. We're going to have you back on, and we'll talk about your fertility journey, which is a very interesting story in itself. But I want you to thank you for coming on, sharing your story, because a lot of guys don't want to talk about this shit. That's the bottom line. So I think this really is going to make a lot of difference for a lot of people out there who can learn from your experience from the comforts of their homes because they're scared to talk about this, scared to learn about it in other ways. But thanks again for coming on. Thanks to all of our listeners for listening. As always, you can check out our podcasts on all podcasting platforms, Spotify, iTunes, Amazon. Give us a download, subscribe, review 5 stars, and then on our socials at the Man Up Pod on TikTok, Instagram, and Twitter. You can also follow us on YouTube. Subscribe there. For Kevin and Mike, thanks for listening. Until next time, have a good one.